Good day, everyone. For today's lecture, we will be discussing multi-drug resistant organisms, or your MDRO. MDROs, these are pathogens that develop resistance to one or more commonly used antibiotics. There are different types of our multi-drug resistant organisms. We have your gram-positive and we also have your gram-negative MDROs. Let's start first discussing your gram-positive MDROs. First is we have your MRSA, or your methicillin-resistant Staphylococcus aureus. This includes Staphylococcus aureus cultured from any specimen that is resistant to oxacillin, cefoxitin, and your methicillin by standard susceptibility testing methods. So if we have any culture result that is the result is Staphylococcus aureus, then you can find or you can see on the result that it is resistant to the following antibiotics. Then consider that one as MRSA. Next, under your gram-positive MDRO is we have your VRE, or your vancomycin-resistant enterococci. This includes your Enterococcus faecalis, Enterococcus faecium, or Enterococcus species unspecified that is resistant to vancomycin. Okay? So if the result on the culture is Enterococcus, it could either be on the following species, then it is resistant to vancomycin, then that is VRE. The other type of your MDRO is we have your gram-negative MDRO. The first gram-negative MDRO is we have your CRE, or your carbapenem-resistant Enterobacteriaceae. Okay? It's CRE. These are any E. coli, Klebsiella oxytoca, Klebsiella pneumoniae, or Enterobacter species that test resistant to imipenem, meropenem, dorepenem, or ertapenem. Okay? So if you have any culture results under these types of specimens or microorganisms that test resistant on the following antibiotics, then consider that one as carbapenem-resistant Enterobacteriaceae, or CRE. The second multi-drug resistant organism that is gram-negative is we have your cephalosporin-resistant Klebsiella. These are your Klebsiella oxytoca or Klebsiella pneumoniae that is non-susceptible to ceftazidime, cefotaxime, ceftriaxone, or cefepime. The third gram-negative MDRO is we have your MDR Acinetobacter. These are organisms that is resistant or intermediate to at least one agent in at least 3 out of 6 antimicrobial classes. We have your penicillins, aminoglycosides, cephalosporin, fluoroquinolones, carbapenems, and your sulbactam. So let's, for example, MDR Acinetobacter, you can find in the result resistant to at least 3 of the following antimicrobial classes, then that is considered already as multi-drug resistant organism. Now, to further explain regarding your antimicrobial classes with regards to your MDR Acinetobacter, we just need to have at least 3 of the following 3 out of 6 antimicrobial classes, right? As what I have mentioned, the antimicrobial classes is we have your penicillin, aminoglycosides, cephalosporin, fluoroquinolones, carbapenems, and your sulbactam. So let's say, for example, if the patient, any blood result or any culture result, then you found out that if the result of the culture is Acinetobacter, then you need to check the following antibiotics. Let's say, for example, for penicillin, if the result is resistant to augmentin, if the result is resistant to impenem, and if the result is resistant to amikacin, then you can consider that one as multi-drug resistant Acinetobacter. Okay? These are the classes of antibiotics, the one that is on top. These are the classes of your antibiotics. And these are the antibiotics under these antimicrobial classes. Just 3 out of the 6 antimicrobial classes, then you can consider that one as multi-drug resistant Acinetobacter. Next is we also have your MDR Klebsiella or Pseudomonas. It's just the same with your MDR Acinetobacter. It will, if the result is resistant to at least one agent in at least 3 out of 5 antimicrobial classes, like your penicillin, aminoglycosides, cephalosporin, fluoroquinolones, and carbapenems. Okay, as if the result, if the culture result is Klebsiella or Pseudomonas, try to check to find out the antibiotics under these antimicrobial classes. If you find that 3 out of these antimicrobial classes is present or is resistant, then you can consider that one as MDR Klebsiella or Pseudomonas. And the last one for your gram-negative MDRO is we have your ESBL or your extended spectrum beta-lactamases. These are enzymes that confer resistance to most beta-lactam antibiotics, including your penicillins, cephalosporins, and the monobactam aztreonam. Your ESBL are present in Enterobacteriaceae, such as your E. coli and Klebsiella, and other gram-negative, such as your Pseudomonas aeruginosa. Okay, that is your ESBL. The other one is we have your C. diff or your Clostridium difficile. We have been talking this one, especially during orientation when I am talking about patients under contact precaution. Your C. diff, this is not really resistant to drugs. So this is not actually an MDRO, but they are treated like MDRO because it is transmitted in the same way with other MDROs or multi-drug resistant organisms. So how are we going to identify if the multi-drug resistant organism found on any culture is community onset or healthcare facility onset? When I talk about community onset, these are MDRO specimens collected in an outpatient location or an inpatient location that is less than or equal to 3 days after admission to the facility. Let's, for example, days 1, 2, or 3 of admission. Okay? While your healthcare facility onset, these are MDRO specimens collected greater than 3 days after admission to the facility, like on day 4th of admission, so on and so forth. So community admission until 3 days, healthcare facility onset on the 4th day of admission, so on and so forth. Okay? What are the factors contributing to multi-drug resistant organisms in healthcare setting? First is we have your inappropriate and uncontrolled use of antimicrobial agents in healthcare setting. Like example of which is we have your increased use of your antimicrobial prophylaxis. Example is for your surgical prophylaxis. There are certain durations or certain time on when you are going to stop giving antibiotic to your patients. Next is we have your inadequate adherence to infection control measures, especially if you are not adhering strictly to hand hygiene, then most likely MDRO will be spreading inside the hospital. Contact with colonized or infected patients, like lack of isolation. If we are not able to isolate or put the patient under contact precaution, then we will not be able to stop the spread of MDROs in our facility. And availability of vulnerable hosts, like what? Like patients who have severe underlying diseases, compromised host defense, such as patients undergoing dialysis, transplant and oncology patients, patients who just had undergo surgery, patients who have indwelling medical devices, transfer of the patient between institutions, especially suspected ones, and if the patient is staying in the hospital for a long period of time. How are we going to collect sample for, or which site are we going to collect sample for to test or to screen MDRO? Now, screening, it is the collection of specimen from specific body sites known to be associated with colonization by a specific microorganisms. For MRSA, we will be collecting or we will screen on the following sites like your nares, this one, your axilla, and your groin. For VRE, rectal swab or perianal swab. For your CRE, stool sample or a rectal swab. And if indicated, urine in the presence of a urinary catheter, stoma swab, patients with colostomy or ileostomy, wounds, catheter exit sites. For ESBL, stool sample or rectal swab, and if indicated, urine in the presence of a urinary catheter. And last is for your Acinetobacter is nostrils, pharynx, and skin surfaces. How do we manage patients with MDROs? In order to prevent healthcare-associated infections, we must be strictly implementing your standard precautions, particularly your hand hygiene. So strict adherence to hand hygiene is very important. As we all know, the healthcare workers' hands could be the main source of any microorganisms, especially multi-drug resistant organisms in a healthcare facility. Next is implementing contact precautions routinely for all patients infected with target MDROs and for patients that have been previously identified as being colonized with target MDROs. So standard and contact precautions, these are the precautions that we are going to apply for any suspected or confirmed cases of multi-drug resistant organisms. And even also to those patients who have been colonized or infected with MDROs. Next is use masks according to standard precaution when performing splash generating procedures. Reduce device utilization and improve insertion and post-insertion care. So reduce device utilization as much as possible. If the device is not necessary anymore, then remove all those devices and try to pay particular to, especially for our bundles, insertion bundles for any devices, as well as for the maintenance bundles in order for us to prevent any healthcare-associated infections. Where are we going to place all these patients? All patients with MDRO should be placed in a single room. Okay? When single room or when single patient rooms are not available, cohort patients with the same multi-drug resistant organisms in the same room. Place a contact precaution sign on the targeted bed, especially if we're going to cohort patients. Ensure easy access to PP and alcohol-based hand rub, especially, most particularly, if you are going to cohort patients. Practice strict standard precautions between interactions with patients in the same room. Transfer to a single room or cohort to another patients with the same organisms as soon as possible. So you can put the patient, especially, you can put the patient on the same room, MDRO patient and non-MDRO patient, for a while, provided that this patient that has no MDRO is not immunocompromised or not at high risk to get infected with, MDRO. For the meantime, as soon as, while waiting for a vacant room or available room that you can cohort patients with the same organisms. Other thing is we need to enhance environmental measures like start patient dedicated or single-use disposable non-critical equipment. So like your blood pressure cuff, stethoscope, any instruments and devices. If you can dedicate that one to a single patient or for that patient that has MDRO, it would be better. But if not, try to clean and disinfect every after use. Clean rooms every day by the designated personnel with disposable or dedicated equipment. So any cleaning materials that is being used by that case or by that patient, it should be only dedicated on that certain area or case. Change mop water after each isolation patient's room is completed. Wipe mop handles with disinfectant and the mop head will be bagged and sent to the laundry. Clean all equipment with hospital-approved disinfectant after each use. Moreover, we need to clean when durable equipment is used, including but not limited to portable X-ray machines, ABG machines, dialysis machines, etc. The equipment with hospital-approved disinfectant and or according to manufacturer's recommendations before the equipment is used to care for another patient. So cleaning and disinfection is very important before and after patient use. Keep all medical items such as dressing, syringes, IV fluids to minimal in the patient room. If these items found in the patient room after diagnosis with MDROs, all should be discarded. So, prior to the result of the patient's culture, you can, if all those items is available inside the patient's room, then once the result came out and it is a confirmed case of MDRO, so all of those things, as what I have mentioned, should be discarded. How are we going to transport patient with MDRO, suspected or confirmed? Keep patient movement to a minimum if possible to prevent the transmission of multi-drug resistant organisms. Perform tests at the bedside if possible. Inform the receiving department about the infectious status of the patient. And if transportation is unavoidable, observe the following. Give bath to the patient before transporting. Seal all open wounds with impermeable dressing. The patient must wear a new gown before transport. Both patient and healthcare workers should perform hand hygiene before leaving the patient's room. Remove and discard of contaminated PPE and perform hand hygiene before transporting patients on contact precautions. So do not forget those guidelines or infection control measures if you are going to transport patient outside his or her room, especially if those patient is under contact precaution. So what are the criteria in order for us to discontinue patient isolation? First is you need to consult IPCD prior to discontinuing isolation. So the infection control practitioner's recommendation is a must. Discontinue isolation of MDRO positive patients after 3 consecutive negative cultures from all previously positive sites. If the first set of samples, which was taken 3 days of antibiotics, is negative, repeat cultures 48 hours later and consultation with your infectious or IPs, infection control practitioners. How about for our linens? Keep all linens in yellow bags. Okay? Keep all linens in yellow bags. Do we allow visitors to visit any patients suspected or confirmed of having MDRO? So do not allow sitter except if medically indicated. Educate the sitter to follow infection control precautions. So your education is very important in order for us to minimize or to stop any transmissions. Make sure all visitors of patients who are on contact isolation for MDRO should follow the isolation requirements like strict adherence to hand hygiene, wearing of your appropriate PPE, which is your gloves and your gown. Make sure isolation requirements are followed whenever possible in the case of visitors who sleep in the patient's room. Put on a clean change of clothes and perform thorough hand hygiene must be followed by the visitors prior to exiting the patient's room if gowns and gloves are not worn when sleeping or during prolonged hospitalization. So the last one means if the patient is not or the sitter is not wearing any gloves or gown inside the patient's room, he or she must change the clothes that he or she is wearing before he leaves the patient's room, and strict hand hygiene practice should be observed. And for our nurses and doctors and any other healthcare practitioners, make sure patients with MDRO are seen last or at the end of the day, if possible, including patient traveling to wound care room or physiotherapy rooms, physical therapy or occupational therapy or speech therapy. So this, I think we are practicing that one, that infectious patient should be seen last. As you can see on the slide, this is our multi-drug resistant organism bundle. It is composed of a group of indicators to assess the preventive practices related to antimicrobial resistance. So bundles, if you're going to do it all together, then you will achieve desirable results, okay? Not only for MDRO, but for any other bundles that we have or we are using in the hospital. Components of our MDRO bundle is we have your hand hygiene, decontamination of environment and equipment, active surveillance culture, contact precaution for infected and colonized patients, device bundles like your central line, urinary catheter, and your ventilator bundles, antibiotic stewardship, so the use of our antibiotic stewardship or your antibiogram, treatment according to cultural results. If the component is met, then just put yes. If not, just put no. If not applicable, then just put an A. Just check those boxes accordingly. So that ends our lecture or topic regarding multi-drug resistant organism. Just a reminder to pay particular on the precautions, infection control precautions with regards to your multi-drug resistant organisms, so that we can be able to minimize or to stop the spread of infection for those patients that is colonized or infected with multi-drug resistant organisms. So your precautions and your knowledge on these precautions is very important for us not to spread any infections. Remember that your hands is very critical. These are very, your hands could kill if you're not going to strictly adhere to hand hygiene and if you're not going to follow infection control precautions relating to any cases of multi-drug resistant organisms that is present in our healthcare institution, present to our patients as well. So thank you very much, and I hope to see you again on our next lecture or topic, which is your SSI bundle.